In today's episode, we'll be touching upon another epidemic within the ongoing pandemic that has wreaked havoc in India and its possible entrance to the Sultanate was circulating on social media, which the Ministry of Health has outright denied. Yes, I'm talking about mucormycosis, which is commonly known as black fungus. After looking deep into this subject, what I've understood is that this potentially fatal fungal infection, black fungus, is likely occurring in those patients who are infected with coronavirus or recovering from it. According to the Centers for Disease Control and Prevention, commonly known as CDC, mucormycosis is caused by a group of molds called Mucormicosis, which are found in soil and organic matter like composite piles. It mainly affects people who have health problems or take medicines that lower the body's ability to fight germs and sickness. Black fungus most commonly affects the sinuses or the lungs after inhaling fungal spores from the air. It can only occur on the skin after a cut, burn, or other type of skin injury. I have also noticed that health experts have constantly pointed a close link with those who have diabetes or conditions which compromise the immune system. Experts have said that an overuse during the COVID-19 pandemic of certain drugs which suppress the immune system could be causing the surge. There were some very interesting articles published by various international media houses and scientific organizations on the occurrence, treatment, symptoms of these fungal infections. According to Scientific American publication, Marine McKenna on May 28 stated that black fungus can infest the sinuses and bones of the face and invade the brain or cause patients to lose an eye. When it goes untreated and treatment is prolonged and difficult, mucormycosis can kill up to half of those who contract it. There have been almost 12,000 cases of the infection in India in recent months, with most of them occurring in the western states of Maharashtra and Gujarat, she wrote. According to various health experts, fighting coronavirus can leave people's immune systems compromised or weakened, which means they may have a higher chance of developing mucormycosis, or like we say, black fungus. Another thing that McKenna mentioned was that these fungal infections arise after a COVID diagnosis, which seems to be a clue. A standard component of treatment for severe cases of COVID is high doses of corticosteroids, anti-inflammatory drugs that damp down the immune system's overreaction to infection. She said that steroids save lives, but they simultaneously make a patient more vulnerable to attack by whatever bacteria or fungi are already in their body or hanging around their environment, like what I mentioned earlier. So basically, while a patient or patients is being treated for the ongoing pandemic coronavirus, which has gripped the world since the end of 2019 and doesn't really seem to slow down its pace, it is on the other hand also making human immune system vulnerable to picking up on more potentially fatal infections, including multisystem inflammatory syndrome in children, a rare but serious complication associated with COVID-19, which we spoke in detail with Dr. Zaid from Sultan Qaboos University Hospital in one of the earlier episodes. Another interesting and detailed article by one of the India's top English daily, the Indian Express, presentation of two types of mucormycosis have been commonly observed with COVID-19 patients, whether active, recovering, or post-discharge. This includes rhino-orbitocerebral mucormycosis, commonly known as ROCM, and pulmonary mucormycosis. Let's look into the first type, which is the ROCM. In simple words, ROCM means the mucormycosis in which the fungus affects the nose, eyes, and brain. This disease originates from the nose and rapidly spreads along the sinus passage to infect the orbit, bone cavity which surrounds the eye and brain. Hence, the infection can be classified into 3 stages. In the initial stage, the patient will experience either nasal blockage or congestion, nasal discharge, it could be bloody or brown or black in color, and localized pain inside the nose. The patient will then start to develop facial pain, numbness, or even swelling of the face. As the infection progresses and reaches the orbit, the patient begins to experience headache and orbital pain, which means pain in or behind the eye. Blurred or double vision with pain, vision loss in one or both eyes, partial or complete blindness can also be witnessed. Toothache, loosening of teeth located in the upper jaw, and dysfunction in jaw movement. Paresthesia or abnormal sensation in the skin such as tingling, chilling, burning, or numbness can also be experienced. Patients also exhibit fever, skin lesions, and a black scar on the skin near the eyes or nose. Unstable gait, altered consciousness, and seizures indicate the spreading of the fungus to the brain. Now, pulmonary mucormicosis. Primarily affecting the lungs and respiratory system, pulmonary mucormicosis is common among immunocompromised patients whose immune systems have lowered ability to fight infections and diseases. Patients with pulmonary mucormicosis exhibit symptoms including fever, cough, shortness of breath, and chest pain. Some individuals go through hemoptysis as well, which means coughing up blood. Respiratory symptoms worsen as the infection spreads, and patients may observe pleural effusion as well, which means fluid collection in the outer covering of lungs. In terms of early detection, according to McKenna, identifying a case of black fungus early can be challenging. Unlike some other fungal infections, there are no blood-based tests that can detect it. Diagnosis require doing a biopsy, examining the sample, and sometimes following up with a CT scan. Symptoms of sinus and brain black fungus include facial swelling, nasal congestion, and headache. If it makes it to the lungs, symptoms include fever, cough, and shortness of breath. Now, depending on what part of the body is affected, black fungus can be fatal in up to 96% of cases as per CDC. For example, the mortality rate was 46% among people with sinus infections, 76% for pulmonary infections, and 96% for disseminated mucormicosis. According to Healthline author Amarjeet Kumar Singh and Anadalu Agency, both in India, experts said the cause of black fungus is a combination of factors. These factors might include contaminated oxygen equipment and use of steroid drugs to treat certain coronavirus patients. As of May 26th, India has recorded 11,717 cases of black fungus, with Gujarat, Maharashtra, Andhra Pradesh, Madhya Pradesh, and Telangana logging the highest number of rare fungal infection according to the latest government data. While Maharashtra has reported 2,770 cases, Gujarat has logged 2,859 cases, Andhra Pradesh has registered 768 cases, Madhya Pradesh has 752 cases, and Telangana has 744 cases so far.